Welcome to GovCast, connecting with federal IT's top decision makers. I'm Alexander Bolova, production lead at GovCIO Media and Research. With me today is staff writer researcher Jordan McDonald. Hi, Jordan.
Hi, Alex.
You had the opportunity to chat with Amber Pearson, Executive Director of Information Security Policy and Strategy at the VA. How'd it go?
It went really well. Amber is really insightful, gave a lot of information and helped me understand the ways that the VA is tackling cybersecurity. You know, there's a lot of emerging technologies nowadays like AI, telehealth, telemedicine, remote patient monitoring, Internet of Medical Things. You can name whatever. The point is, as we get all these new emerging technologies, Amber was really adamant about making sure that they're secure at the same time. There are so many different avenues now for cyber attacks to happen, ransomware attacks, you name it. And the VA is doing a lot to make sure that veterans' health and data is secure at the same time. Amber focused on the ways that the VA is making sure that as these new technologies develop, that they're secure by design. They're secure when the VA adopts them into their fold, and making sure that, like, as these new technologies come, they're not putting veteran data at risk.
Yeah, cybersecurity is so important for an agency like the VA that has such sensitive data on hand at all times. And the need for it to be accessible really has to be balanced with the need to keep it safe. Well, with all of that in mind, let's take a listen to your conversation.
Hi, I'm Jordan McDonald. Welcome to GovCast. Today, we're joined by Amber Pearson, who is the Deputy CISO and Executive Director of Information Security Policy and Strategy at the Department of the Veterans Affairs. Hi, Amber.
Hi, Jordan. Glad to be here. Excited.
Absolutely. Could you please give us sort of an introduction to your role, what it is that you do as a Deputy CISO at the VA?
Absolutely. So my role within VA is the Deputy Chief Information Security Officer, Deputy CISO, and the Executive Director of Information Security Policy and Strategy. So very long title. So what does that really mean? It means that I'm responsible for the movement of all cybersecurity compliance and federal regulatory requirements, ensuring that we have a thorough and robust information security program. I'm responsible for information security engineering, security architecture, advancing in risk management framework, so all things assessment and authorization. And I also have security policy up under my belt within VA.
Absolutely. So you have a lot of different roles and tasks within the agency. You know, there's been a lot of talk about the ways that emerging technology can help government. In particular, I'm curious how the VA can use it, and I guess the promise of emerging technology, but also maybe some of the risks that it might cause, and like how the VA is looking at managing all that.
Yeah, great question. As you see emerging technologies such as artificial intelligence and just the adaptation in where we're moving in healthcare delivery overall, you see more telehealth, telemedicine, remote patient monitoring, and Internet of Medical Things, IoMT. All those things have transformed really how we deliver healthcare. And these advancements also pose new security risks and very specific vulnerabilities. And so when you think about the sheer volume of data that's generated by personal and home healthcare devices, those actually change the attack surface. So the more data we have, the more it's being interconnected to larger scope items and systems. Now we're looking at how do we strategically put protections in place for our patient information. So for example, if you're using a telehealth app, this could potentially pose some risk in how sensitive data is shared. There's risk in an adversary or a malicious actor either intercepting that connection and stealing that data. And so that's where interconnectivity of these devices creates additional entry points for potential cyber attacks. It increases the complexity and how we actually maintain security. And so how VA has structured its information security program is really looking at how do we reduce the risk? How do we mitigate those risks? And so we really adopt the concept of secure by design. And so with secure by design principles, they're employed in initial stages of technology development. And we make sure that adherence to standards, security standards, is critical so that those benefits of those new innovations, those additional attack surfaces that we're creating and those innovation technologies, they're not overshadowed by potential risk to the patient health and data security. One of the main risks, as I talked to just a little bit, is the attack surface. So that direct feed, in my example from that medical device to a larger health record system, introduces new capabilities and new pathways for malicious actors to be able to actually intercept the data. And also the connected device, in essence, it provides a potential entry point for access to that sensitive information and overall disrupt healthcare operations. So those are the complexities around some of the emerging technologies and how we try to look at how do we ensure that we're protecting the data? How are we protecting those interconnections so that there's no exploitation of those medical devices? We've seen in recent years an uptick in ransomware attacks in just the overall healthcare community. And so ransomware attacks are designed to lock down those systems and IT assets with the goal of extorting payments or disrupting the healthcare service altogether. And so one of the most recent hospital cyber resiliency analysis that it showed 80% of cyber attacks leverage identity-based attacks to either compromise those credentials. So when we think about multi-factor authentication, BA is really increasing the rigor around access controls. And we adopt that zero trust mentality as well, assuming breach. And so we're doing a lot of focus in this area around how do we protect our assets and then how we prevent such techniques such as ransomware attacks to prevent that lateral movement in our networks. And so that's just the overarching view of where VA is going with how do we manage the risk around that innovation aspect, because we want to make sure that we're able to deliver world-class care for our veterans, their families, and caregivers.
Absolutely. So two-factor authentication, zero trust, a lot of
Absolutely.
things that we've seen before. But sort of curious, as you're like implementing all this, what are some of the challenges? What are some of the difficulties when it comes to building out, such an extensive cybersecurity network for the VA?
Yeah, so one of the complexities is around the communications path, ensuring that the security of the data is transmitted between those medical devices and the systems. We want to make sure that there's encryption, data at rest encryption, ensuring that the protection in transit and at rest. So there's two aspects of data encryption that we really focus in on. And then I talked a little bit about access control. So increasing our rigor around access control measures is very critical for us. And that complicates the diverse nature of just medical devices. And as you know, when we think about healthcare delivery, patient care, we want to make sure that that uptime is and the systems are available. Like that's the main purpose around ensuring that availability is there for it to treat patients. And so with that need for that real-time data exchange, it puts that pressure on security on the healthcare of IT systems. And so when we have that prioritization of uptime and connectivity, we see that there's an introduction of expense at the of security. And so together with industry, we're coming together to make sure that we're introducing some risk-based approaches in how we protect the data, and also making sure that we can keep up the updates and the maintenance and not impact that patient care. And so sometimes when you think about the healthcare setting where real-time data is critical, we want to make sure that we equate that to security.
Absolutely. I want to follow up on something that you mentioned about communications. And, when we think about cybersecurity, it's only as strong as the people who are, using it in their daily lives.
Absolutely.
I'm sort of curious, like, how do you work with the people in the VA to, up their cyber hygiene and make sure that they know how to use security to its best and fullest potential?
Yeah, I liked how you phrased that question because when you think about the innovations that are happening across healthcare industry, your security posture is only as strong as your weakest link. And so we want to make sure that we have the appropriate security controls in place to protect those devices. And so we've worked closely with CISA, FDA, and others to making sure that industry is taking a different approach and ensuring that we're able to procure devices that have security at the beginning, right? So when you think about the cost of security, so if you're constantly trying to get after security after the fact, it's always more costly. It's very complex and introducing after the fact as well. So one of the things that how we get after that is really shifting towards the procurement side of the house and how we buy our products. And so shifting that mindset overall to all of our manufacturers, making sure that they understand we equate patient care delivery with also with security. So we want to make sure that we're putting those appropriate contracts in place and ensuring that vendors and anyone that we're working with understands the security requirements and how to deploy those into our products before we procure them. So making sure that those vendors are meeting those security standards is key.
Yeah, absolutely. And you've talked a little bit about the ways that you've worked with industry. Could you sort of give me a rundown of how partnering with industry has also been important for the VA cybersecurity?
Yeah, so one of the biggest things that we're working with FDA on right now is improved identity, credential, and access management procedures and process and the capabilities overall. And when we talk about zero trust, one of the main areas is increasing rigor around your access controls. And so multi-factor authentication can sometimes be very difficult when you think about what it takes to actually put that in place for some medical devices. And so when we look at devices such as that, we want to make sure we're concentrating on the ability to make sure that we're enabling a unified end user experience, but also restricting access based on specific roles. And so that's one of those partnerships that we have with FDA currently around multi-factor authentication and how we actually deploy some of those critical security controls to our medical devices and special purpose systems.
Absolutely. Just to finish out here, the world of technology is moving incredibly fast, and there's innovations and threats and risks all over. I'm sort of curious how the VA in the future is looking to tackle cybersecurity as, technology evolves and maybe there's new vectors and the attack surface increases and everything we've talked about throughout the conversation.
Yeah, so since veteran patient data is a complex task, complicated by the fact that healthcare is a prime target for threat actors, our veterans are often targeted for fraud and scams. And in a recent commission, for Federal Trade Commission, showed that veterans reported about $300 million in losses to fraud. And so our focus in that area is to make sure that we're presenting potential vulnerabilities at the scale of VA operations, which, as you know, we encompass over 2,000 locations with tens of thousands of systems and devices, which adds an additional layer of complexity. So we look at deploying and securing and monitoring our assets constantly. So we're always looking at an opportunity for continuous improvement when it comes to our information security programs. One of the things that I want to point out is just the sheer volume of the data generated, stored, and transmitted by VA medical devices on a daily basis. It requires thoughtful architecture processes to include, BISMA related processes where it's risk management framework, and also your infrastructure that can quickly adapt and effectively scale. So some of those cybersecurity solutions, really we go after ensuring strong authentication and security measures are everywhere all at once without impacting that service delivery. And so while we see ourselves balancing that need between resiliency with security and the commitment to delivering that world-class healthcare experience that our veterans so desperately need. And so we want to make sure that we are communicating and also socializing some of those complexities and partnering with our some of our partner agencies to make sure that to show that VA is dedicated and motivated by that work, because it allows us to serve our veterans differently, right? And again, I talked about equating that patient care with healthcare delivery is critical for us. And so some of those things include regulatory requirements, mentioned FDA, and how some of those cybersecurity monitoring solutions, such as network scans or even endpoint detection and response tools for our medical devices, we want to make sure that we're adhering to those security standards and tailoring it just for that specific need of a VA. So again, maintaining that balance between pushing for that improvement and also allowing our teams to accomplish our current tasks. It's crucial for our teams to deploy those monitoring efforts.
Thank you so much, Amber, for sharing such an important, aspect and component of our government. Before you go, I just wanted to ask if there's anything that we didn't talk about that you think is like really critical for understanding the VA and healthcare and everything you're doing with cybersecurity.
Yeah, it's a lot. I would like to talk a little bit about some of our proactive actions that we've taken to take us to the next step. So as we see healthcare delivery change and just all the innovations that we're seeing in industry, some of the things that we're really aggressively getting after is, automation. And so we've partnered with NIST on open security assessment language, OSCIO. And we're using that. And that what OSCIO is, it's aligned to our security authorization documentation to further that automation capability within the risk management framework process. And so we want to be one of the first federal agencies to implement OSCIO so that we can effectively steer our strategies to supporting our communities a little bit better. And we believe that automation is really going to get us to that next level and where it's no longer drowned in paperwork to meet regulatory requirements. And we're moving to get security at the very front end. I talked about secure by design. And so that pushes that security requirements up front and early, and it's automatic and it's driven by the capabilities itself, the technology itself. So that's one of the areas that we're aggressively looking after to help us become more proactive. We're also positioning VA at the forefront of FedRAMP conversations around where the government is taking cloud security. With leveraging our newly established FedRAMP partnerships, VA is driving some very key FedRAMP outcomes, specifically around major cloud service providers, where we're requesting our cloud service providers to give us that at the federal level, that actionable security guidance to help us strengthening the hardening of our systems. And so that's another area that is going to help us achieve that level of security that to help us reduce the risk when we think about where we're going from a healthcare industry standpoint with all the innovations that we're seeing. A lot of these capabilities are within the cloud. And so we want to make sure that we as customers are able to properly harden those cloud services. And so that's a key focus area for us that I want to make sure I mention as well.
Absolutely. Well, thank you so much for joining us on the show, Amber.
All right. Appreciate it. Thank you.
Thank you, Jordan. That was a great chat with Amber Pearson. Before we let our listeners go, are there any last highlights or takeaways that you want to leave them with?
Yeah, absolutely. One thing that Amber really focused on was that a security posture is really only as strong as its weakest link. And, she's talking about the ways that, one, she's trying to get VA as employees to understand and learn cyber hygiene to secure patient data, but also working with the way other agencies like CISA or the FDA to help, improve and unify the ways that government as a whole is tackling cybersecurity and making sure that not only veteran data, but data from all different types of agencies is secure.
Well, thank you again, Jordan. Listeners can tune in next week for a brand new podcast in our GovCIO Media and Research feed. But until then, if you like what you heard, make sure you leave a review and a 5-star rating. Make sure you're subscribed as well. And hey, tell a friend. We always appreciate growing our audience. I'm Alexander Bolova.
And I'm Jordan McDonald.
Thank you for listening. GovCast, along with HealthCast and CyberCast, is a production of GovCIO Media and Research. To explore our content, visit our website, govciomedia.com. Keep an eye out for new episodes every Tuesday. And if you like what you heard, leave us a review on the podcast platform of your choice. Have a topic you want us to discuss? Contact us at newsletter@govcio.com.